I think what we've come to realize is that coronary motion is a very complex phenomenon. Coronaries twist, stretch, rotate. They do a variety of motions. A proximal LAD will rotate very frequently in a different direction than a mid LAD. I think what modern stents have done is they become really flexible, so they don't fracture as much. So I think they do bend very nicely, but they don't like to rotate because the cage seems to restrict rotation. Stents do impact your natural rotation, which makes sense if you think about it, right? You have a nice biological system that behaves freely, and then you place a stiff metal scaffold, and it clearly impacts your rotations. Stents do fail. We know this. Stents restenose, stents thrombose, stents fracture, right? So we have clearly observed that there is vessel motion, and that stents affect vessel motion. I mean, stent fractures would be probably one of the most extreme examples. We've made stents super deliverable. We've made them very thin. We've figured out the polymer. We figured out deliverability. And now I think we're looking for the next frontier. What will make the stent even better in the next generation? What sets the bioadaptor apart is that it allows the vessel to move more naturally. I think it does not restrict its natural motion. It is a much more physiologic implant than our traditional stents. What our study really showed is that we can very precisely measure clockwise and counterclockwise motion of the coronary artery through the cardiac cycle. I think the study showed very nicely that when you place a traditional stent in the coronary, you do restrict coronary rotation. And I think that came to no surprise. However, what the bioadaptor does is it uncages itself because the polymer just goes away and the stent becomes more freely movable. And we were able to measure this and quantify this. It also rotates because the links separate from each other. So I think it's an additional motion that this stent has, which a traditional stent design does not have. I think the question always arises is, are there coronaries or coronary lesions or segments that could be more prone to rotation? And one that immediately comes to mind is proximal to mid LAD. And what we've noticed is in our measurements is that these two segments demonstrate very frequently rotation in opposite directions. So while proximal LAD could be rotating clockwise, the mid may be going counterclockwise. And it is very impressive to see that there is a transition area where the vessel doesn't rotate. So think about it clinically. You're stenting a proximal to mid coronary lesion. You're placing a 38mm stent, and then you're overlapping with another 28mm stent. It is almost certain that you will go through three different zones, one of clockwise, one of counterclockwise, and one of no rotation. It is very plausible that some portions of stent failure may be due to inability of the vessel to conform or rotate with the stent. So I would say if I had to pick one area that I find the rotation probably most important would be proximal to mid LAD. Mid right coronary artery, not only does it flex, but it rotates quite considerably. So that would be my probably top two area where a long stent for a diffuse lesion in a mid RCA, the rotation would be quite important. I think the ideal stent would completely preserve natural movement of the vessel. And I think if you can achieve this with a permanent metallic implant that doesn't affect the coronary motion, yet provides you the scaffolding and radial strength that you need, I think that would be the optimal solution. We frequently look at stents as acute and subacute devices, but we frequently overlook that they will be left in coronaries for years of active patient's life. And I think what we are now able with modern technologies to achieve is that stents over time can become more conformable. And this is what the bioadaptor really does. And that's why it's so novel and exciting, is it uncages itself and becomes more mobile with time. If we can understand rotation better, which I think there's a lot of work to be done, I think we'll be able to develop better devices such as bioadaptor, which allow natural motion of the coronaries and then likely reduce need for additional procedures and improve, in the end, patient outcomes.